We'll start in about a minute. We're just letting participants join. Okay, I think we'll get started. We've got a great big list of attendees. I'm here to do the welcome. So my name is Kristen Cleverly, and I lead the Global Speaker Series. I'm an investigator at the University of Toronto and the Centre for Addiction Mental Health. So welcome. This is part of our Global Speaker Series on post-secondary student mental health research. This event is the continuation of a virtual event series developed in part of our Global Research Network. The founding members are the University of Toronto, King's College London, National Taiwan University, and the University of Sydney. It's funded by the Connaught Global Challenge Award at the University of Toronto. The goal of this speaker series is to provide opportunities for faculty, staff, and students of all levels to present their interests and expertise in the interdisciplinary field of post-secondary student mental health. Additionally, we want to provide knowledge generation, dissemination, and expansion to the field of global student mental health research. Today's seminar is hosted in partnership, excitedly, in partnership with the Collaborative Center for Climate, Health, and Sustainable Care. It's a new multi-faculty unit here at the University of Toronto, founded by the Dalla Lana School of Public Health, the Temerty Faculty of Medicine, the Lawrance Bloomberg Faculty of Nursing, and the Leslie Dan Faculty of Pharmacy. To learn more about the Collaborative Center for Climate, Health, and Sustainable Care, and receive notice of more seminars on the intersection of health and climate, please see the links provided in the chat. Please note that a feedback session will be shared following the session. We invite all attendees to complete the session, complete the form at the end of the session. I would like to now introduce Will. It is my pleasure to introduce William Hill, who is our moderator for today. He's co-founder and managing director of the School of Innovation, which is set to become the first new independent university in Northern England since 1964, upon its launch in Manchester next year. Additionally, he holds a visiting lecturer position at Edge Hill University Medical School and serves as a trustee for the mental health charity It Gets Brighter, and is a strategic advisor to one of our great partners, the charity Student Minds in the United Kingdom, and is founding partner of Brave Kids Academy, a school located in Uganda, Africa. So welcome, Will. I will pass it over to you.
Thank you, Kirsten. Welcome, everybody. Today's session will include a presentation from Dr. Siqi Xue from the Centre for Addictions and Mental Health in Canada, and Dr. Emma Lawrance of Imperial College, London in England, who will both be discussing the topic of climate change and our campuses, impact and action for student mental health. We're also very excited to be joined for the Q&A portion of the event by our student discussant, Michelle Buda from the University of Toronto, Canada, to further explore the impact of climate change on mental health, as well as opportunities for individuals and community-based action and intervention on post-secondary campuses. During the Q&A session, the audience will be invited to ask questions, and the Q&A function is different from the chat function in that the questions are directly sent to the speaker and answered. So Emma, I invite you to turn on your video and deliver your wonderful presentation.
Thanks so much, Will. I'm just the host, I think, needs to let me share my video again, if that's all right, but I will start sharing my slides in the meantime.
Sure. While that happens, I'll give you a great introduction. So Dr. Emma Lawrance is the mental health lead at the Institute of Global Health Innovation, Imperial College London. She leads the Climate Cares Centre, working with diverse experts to better understand and respond to the deep interconnections between climate change and mental health, including through Connecting Climate Minds Global Initiative. She holds degrees in physics, chemistry, science, communications, and neuroscience. That's a lot. Okay, cool. Emma.
Great, thanks so much, Will. I've also been my pleasure to work with Will over the last year, so wonderful to be joining with him and with Siqi to get to speak to all of you and get to learn from your questions as well, which we will hear from you in just a moment. But first of all, just to say, so I'm coming from the Climate Care Centre, as Will said, at Imperial College in London, and we're really working to understand the deep interconnections between the climate crisis and our mental health and well-being, and how the challenges that are affecting our planet are also affecting our minds, communities, and healthcare systems. And so we work across research, but also policy, education, intervention design to better understand and support mental health in the context of the climate and ecological crises. But before I dive into more details about what we've learned and who we've heard from around the world and what we can do about these interconnections, we want to hear from you. So if you're all happy to get out your phones or your laptop, whatever device you're joining on, you can go to mentimeter.com and type in the code. It'll ask you for a code. You can type in 1559-6477, or you can use the QR code to scan on your screen. And either way, you should be able to go to the Mentimeter. So I'll just give you another few seconds to do that, and then I'll open it up. So hopefully people are able to do that. I can put the code in the chat if people can't get to it, but otherwise I will make sure we can make this as big as possible. So make this the whole screen. Hopefully you can mostly see that. So why did you join today is the first question, to hear why have you come? So hopefully we can respond to that. So here, out of interest, that's great, how students are coping with climate anxiety and how to discuss it with the public. PhD student working in a similar area, want to learn about these links of climate change and mental health, work directly with student mental health, hoping to serve students even better and share information. Interested in climate change and mental health. It's a new and evolving research area. Excited to learn about this intersection. Great. So I'm really glad there's that energy in the room. Hopefully we deliver. A lot of people interested to learn, interested to apply this to supporting students. Brilliant. So next slide, maybe a bit more personal, is what comes to mind when you think of the climate crisis? And this could be different feelings you might have, different narratives you've heard, different thoughts, and if you can be as succinct, so a word or two that comes to mind. That word might be, related to a thought, related to a feeling, anything that comes to mind. Okay. So what thoughts, feelings, narratives, values, and experiences come to mind? I think, can everyone, I'm sure if everyone can see this next one?
At least for me, it's saying the presenter hasn't changed slides yet. I don't know, maybe for others.
Interesting. All right. Very fun. Gosh, okay. We go forward. I'm not sure why this is happening.
It's there now. It just came up.
Let me, it's there. Okay, yep. Amazing. Sorry, the joys of technology. So yes, give people a minute to respond to that. Stressful. Okay. Big weather, fear, worrying, our life, decolonization, very important. Hopeful, nice positive one, feeling meaningless, scared. So my kids' future, general death anxiety, which is often linked to climate anxiety, that it's universal, that this is affecting all of us in different ways, that my kids, so thinking about our children, the impacts that it has, what this means, different feelings, need for advocacy. So some of these are more action-oriented, Some of these are more about the effects themselves, like wildfires, disruptions. Some of these are around big weather. Some of these are around feelings like hopelessness, helplessness, what we can do. So yeah, thank you for sharing all of those. And just to see, you know, how we're all in this sort of similar experience, and that there are many common experiences, as well as, of course, everyone being affected differently. Okay, so I'll stop that for now and go back to the presentation. So what we've been trying to do is unpack all of these different ways that affect how people are thinking and feeling, and ultimately their mental health in the context of the climate crisis. And the ways that people can be affected is via a whole range of different pathways and mechanisms. So some of you, particularly thinking of student mental health, might be thinking maybe primarily what might come to mind is climate anxiety and what happens sort of on this right-hand side of this continuum, where people might be witnessing or learning about these impacts. But there's also impacts from people being directly affected, and as we're seeing more and more, including in Canada and North America, with more direct damage and loss of homes and property, experiences of extreme high temperatures and weather events, and hurricanes and fires and things that are affecting people directly. But this leads to other things like crop and livestock damage, forced migration, loss of habitats and changes to livelihoods, communities breaking down and health systems being disrupted, and also education systems being disrupted. And witnessing these changes and experiencing these changes can have a whole range of flow-on effects. And this can look like a whole range of mental health impacts. So when I talk about mental health impacts, I'm talking about a full spectrum of things, from increased cases of things like, sadly, suicidal thoughts or deaths by suicide, increased symptoms and new cases of mental illness, increased susceptibility to physical ill health or death for those with diagnosable mental illnesses, worsened population mental health, and mental and emotional distress across the population. And so what this looks like for young people in particular, this can be from directly experiencing climate impacts. So we know that sadly, children born today or in the last years will face up to 7 times as many extreme weather events as their grandparents. And when people directly experience climate events, this can be things like heat. We know that children directly experiencing higher temperatures, both even before they're born or in early childhood, it can change the way that their brain is being wired up. It can then affect their likelihood of neurodevelopmental disorders or mental health issues later in their life. And when I say children, this can also refers also to young people, will be experiencing more across their life. Students will be experiencing more across their life than in previous generations. And those direct experiences can be traumatic. They can lead to stress, to anxiety, depression, substance abuse, and can be quite long lasting without the right support. But of course, there can also be experiences of things like post-traumatic growth, and with the right support, people don't have to have these long-lasting effects, but it can occur for many. Also, climate awareness. So what we see in our data in the US is that from surveying thousands of young people, we asked them about a whole range of experiences, different thoughts and feelings around the climate crisis, and also asked them about their different behaviors and life plans, and whether they had been directly affected or not. And we see there's an interaction between things like eco-anxiety and different emotional responses to the climate crisis and whether people self-report direct experiences. So people who do self-report direct experiences have much higher eco-anxiety, for instance. They're also more psychologically adapted though. So they are processing and kind of grappling with what's happening, but it's also affecting their decision-making for the future. So they're more likely, for instance, to report being scared to have children. Climate change is also disrupting the conditions for good mental health and well-being. So again, this is sort of adding to what can feel really scary about what's happening. But I do want to note that I will get to the flip side of some of these interconnected challenges and how we can act and intervene and use these interconnections between climate and mental health for good outcomes for both. But at the moment, you know, with climate disruption, that it's undermining what we know is good for mental health and well-being. So these are things like gender-based violence, conflict, forced migration, food and water insecurity, but can also really be experiences around education, healthcare, all sorts of things. So over the last couple of years, I've been leading something called Connecting Climate Minds, which has brought together people across different countries and cultures and backgrounds across both climate and mental health to really see how we can connect and understand these experiences and emerging experiences, but also fundamentally respond to them, because that's really vital. And connection is really a huge part of the response of how we do research and also how we respond and really center lived experience needs. So with over, actually in the end, over 1,000 people across 90 countries, we developed agendas for priority research and action and identified what is emerging in terms of people's lived experience needs. So this included dialogues around the world and in person, and also we worked with and were led by young people, Indigenous communities, small farmers and fisher peoples. And so these outputs included 10 regional and thematic agendas, case studies, lived experience stories, and all of these are showcased on a global online hub. So I can put this in the chat later. So if anyone's interested, there's all of these stories from people around the world, including a lot of young people. There's an agenda that was written by young people. There's toolkits, for instance, for how to do this research, 101 for people coming into this space, and also working with people who have lived experience in this space, and how to use this in terms of humanitarian policy and practice. There's also a global agenda that you can check out. Also, if you're, I know some of you were saying you're studying in this area, would like to know more about what research is happening, what's at the forefront of research and action, and where the gaps are and where you can contribute. And this includes for educators. So our youth-led agenda brought together 150 young people around the world through a series of virtual and in-person dialogues to really understand again and work out what they want. And they completely authored the whole agenda. So this was what was developed in terms of an illustration during one of the dialogues themselves, just to show the range of things that were being discussed about how the climate crisis affects youth mental health and the disruptions and impacts, but also about coping. You can see over here, and the importance of being in community, finding joy, connecting to positives, tackling stigmatization, having equal participation, having opportunities for young people's voices to be heard. They created a youth declaration, which you can also find on the hub and you can sign up to, and what they're working towards. And so we need to have this vision of the future that we want, as well as what we don't want, and that sense of love and community, of nature thriving, of peace, equality, and you can read their vision in their agenda. So some of the things that came out of that work around young people's mental health and well-being is around the key developmental events in their lives being disrupted. So around education, but also around forming relationships, their cultural practices and traditions, and their choices around reproductive development. And even just things like heat. People were saying in certain parts of the world, they couldn't go out and meet their friends. They can't go out and play, their kids. And so this might be different in different parts of the world and where you're coming from. But these are some of the different challenges that play out in different places. And again, there's things like wildfire smoke or other events, you know, that can affect how people can go out and exercise and play and meet people and all of these kind of things as well. And so one of the youth dialogue participants was saying it's hard enough to cope with existing social problems, livelihood challenges, and physical mental health problems without also fearing when the next climate event is going to strike or what opportunities will no longer be available to you. So it's really this risk multiplier, compounding the stresses people are already experiencing. And education is really, really critical. And with disruptions to education from climate change, it's exacerbating existing mental health issues and limiting the possibilities, well-being and educational capacity. And so what young people wanted was creating safe spaces for people to share as an important support tool, realizing you're not alone in what you're feeling. It's very understandable and even healthy to be distressed about what's happening. But also taking action together can be very helpful, as I'll get onto in a minute. We also heard about the burden psychologically of feeling like adults can be putting the responsibility of action onto the shoulders of youth as the sort of hope for the future, and feeling that there's also hesitation to share their experiences of mental health in general, but also particularly in the context of the climate crisis, for fear of judgment or being misunderstood, and the importance of having safe spaces, which we know are really important for mental health in general, of how people can share and feel connected to each other and just have that space to build those connections and that sense of support. So when we're talking about climate-related emotions, just very quickly, because I know this is what many of you might think of when you think about the connections between climate change and mental health. This is a really emerging area of research, and the research is happening very quickly, but also people's experiences are unfolding. You know, we've never lived through this kind of global level of planetary kind of change before, and when it comes to the climate changing in this way and widespread implications. And so we're all sort of going through this together, of course, in different ways, and climate is exacerbating existing inequalities and experiences of colonization, as came up in the importance of decolonization within climate movements and climate research and spaces and climate justice. But so it's really understandable that there are these experiences of anxiety, of fear, of a sense of homesickness when you're at home, which is what solastalgia refers to, and as the environment's changing around you, and ecological grief. But there's also other emotional responses that these terms kind of often seek to capture. So climate anxiety, for instance, often isn't just anxiety, but people talk about overwhelm, anger, despair, guilt. We saw lots of different words coming up before, but also everyone has a psychological response, and sometimes that could also be denial or disavowal or pushing this away because it can feel a sense of powerlessness or hopelessness or just as too big. And the way we respond is really shaped also by our social and cultural dynamics, how much we care about others and the world, and our different cultural identities. So in global surveys, we see that young people feel very betrayed by their government and by adults. And this really feeds into the fact that it's not just about the climate crisis, it's distress, but about the inaction from leaders and the importance of action and being validated by people who care about them and the adults who are teaching them, and creating space for that. And so I'm about to pass on to Siqi in a moment to talk about interventions that can work at different scales. But one thing that's really important is, again, to come back to that experiencing while the climate crisis is exacerbating mental health challenges and is also a big risk factor for people who already experience mental health challenges. Like, for instance, in British, in the heat wave a few years ago, 8% of the people who died, which is way higher than the less than 1% of the population who live with schizophrenia. People with existing mental health conditions need to be protected, but also, and also they have sources of resilience that we can all learn. But there is a role in all grapple with in the climate crisis, and finding and centering joy and hope, as well as making space for the grief and the distress. So it is possible to have high well-being and a strong sense of meaning in life if you have high subjective well-being but are also worried. If you have higher hope, meaningfulness, and also actually higher anger came out. So how do we have hope and agency to enable us to hold distress and still have good mental health, and to be able to take pro-environmental behavior? And this can be about how we think about our ideas of the future and the importance of the different narratives, different framing, of making space for our feelings and our emotions, even if we're doing science, even if we're doing research, because we know that a change in feelings is what really changes minds, and also acting differently can change our feelings, but feelings also link to our actions. So we know that inaction can be related to our bodies being overwhelmed or underwhelmed, and our nervous system can sometimes just find it all too much to cope with and be trying to keep us safe in an unsafe climate. But there are a range of both comfortable and uncomfortable emotions that can lead to taking action, and that action itself can support mental health and well-being, including particularly collective action. And so hope is a big part of what can safeguard us from mental health challenges arising from our climate distress. So to protect our mental health and retain high well-being in the face of distress, it can be very important to have hope. But what does hope mean in this context? Because there's different ways to look at hope. We can look at hope as a passive thing, where we want external agencies to bring about the world we desire, and we're only going to act if we're kind of guaranteed the outcome we want. Whereas active hope is much more about becoming active participants in bringing about what we hope for. So what is that vision of the future we want? What are those things that we're working for? And fundamentally, being distressed is showing us that there are things that we love and care about, we want, and we need to celebrate, and we need to stay connected to that source of joy and that meaning and purpose. And to see hope as a verb, and to see hope as part of taking action, and that agency of how we show up in the world, and the fact that that has ripple effects in ways that we can't predict, describe. You know, in sci-fi movies, people go back and say, in time traveling, you know, you can't go back because you're going to change things by one small action, but we never think about the actions we're taking every day, how that has ripple effects in our communities. So it's important to hold space for paradox. It's important to hold space for complexity, and to see the systems perspective and how there are these deep interconnections between our health and the health of the planet. And there are common causes to many of the challenges we face and common solutions. But also in this complexity is this paradox where we have to hold the tension between multiple futures, where there's space for us to grieve, for us to feel fear, but also space for us to see that there are many things to be working towards wherever we're at, to be working towards that better vision of the future, and to be able to still make space for joy, connection, love within the work that we're doing. And we can feel anxious and hopeful together. So by taking action, we can actually be creating a future that is better for our health and our mental health, because there are these common causes and solutions. And climate action can be an opportunity multiplier itself. So not only good for us, but also good for the world if we can create more green spaces, more active travel, if we can be creating buildings that are more efficient. All of these things have big paybacks for our physical and mental health, as well as for the climate, and how we connect and bring nature into our cities. There's just so many win-win potentials. So to go into more of that, I'm going to hand over to Siqi, who's going to speak more to how we make this kind of better version of the future.
Thank you, Emma, for sharing such a wonderful presentation. So up next to continue the presentation, we have Dr. Siqi Xue, who is an academic psychiatrist at the Centre for Addictions and Mental Health. She completed her medical and residency training at the University of Toronto and received her Masters of Science degree jointly from the London School of Hygiene and Tropical Medicine and King's College London. She has research interests in transcultural psychiatry, social medicine, and climate equity. Siqi.
Awesome. Thanks so much, Will, for your introduction. And it's a pleasure to be here. As Emma mentioned, I will be spending the rest of our time with each other talking to you more about interventions, because as we learned, young people and students are particularly and uniquely impacted by this unfolding climate crisis. And there are things that are within an individual's power to do, such as transforming passive hope into active hope. And the question really becomes, what else can be done? What are the roles and responsibilities of community centers, healthcare facilities, or post-secondary education institutions in terms of designing interventions and solutions to better support student mental health? So with these questions in mind, Emma, I, and a few other colleagues in Canada and the UK went about doing a scoping review on psychosocial interventions in response to climate change that have already been implemented, because we want to see what is already out there and what can we learn from them. So our search really had three different components. First is we want to find an intervention. So it can be an active service or a program, but that it can't be just a resource that is to be passively consumed, for example, a book or a list of therapists who are climate aware, or a podcast. We really wanted there to be a component of active participation. And two is that we want this intervention to have been designed or conceptualized with climate change in mind, whether it's after an acute weather hazard or in response to a prolonged a chronic stressor such as drought or sea level rise, but that we wanted the designer of the intervention or the author of the publication, for example, to explicitly link it to climate change. And three is that we want the intervention to either be promoting mental health and resilience or alleviating some mental suffering. And we really wanted there to be a broad conceptualization of this and not just an absence of a psychiatric illness such as generalized anxiety disorder or PTSD, which are also relevant. And so this big search took us across three traditional academic databases. And because we know that there can be interventions that are already on the ground and running, but not necessarily associated with a scientific publication, we went about doing a gray literature search as well and interviewed 26 content experts from 12 different countries. And we were able to yield 37 unique interventions. And the details of the interventions are in this key paper here that we published this year. So if you're interested, check out our publication. If we can go to the next slide, Emma. And so we categorize these 37 interventions according to 4 different categories by the level that they act on. So if you look at the bottom of this diagram, we started with a microsystem, meaning that this intervention is addressing an individual action or within an individual's household. The next level up is the mesosystem, meaning that the intervention is acting or exerting its effectiveness through the power of peer relationships or the social network of an individual. And then there are the exosystem interventions. So they're acting more on local governments, the media, the local institutions. And then finally, there are potentially macro system interventions as well, things that the larger government is doing, whether it's through a law, a policy, or addressing a lot of upstream determinants of health, such as poverty. Next slide, please. So for the sake of time, I'm just going to be highlighting several of these interventions that are particularly relevant for youth or for post-secondary student population. So we'll start by one example of a microsystem intervention. It's an environmental health clinic that was started at New York University or NYU. So individuals who are concerned about environmental issues received quote unquote prescriptions by going to this clinic, but the prescriptions were not medications or therapy per se, but were actually environmental actions. So this was an example of what the clinic described as structured problem-based coping in order to channel an individual's anxiety into particular climate action. And this clinic was featured in a New York Times article called Prescriptions for Health, but the environmental kind. there was a lot of public publicity about this, but it actually wasn't formally evaluated in terms of the outcomes through a scientific publication. As an example of a mesosystem intervention, we found an organization called the Borderlands Earth Care Youth Institute. And this institute offered interventions for Anglo and Hispanic youth aged between 13 to 19 from low-income households living around the border area between Arizona and Mexico. So the youth who were participating in these interventions did hands-on nature restoration work in this area and wrote essays and reflections about land ethics. And so this we thought was a really interesting example of an intervention that was a type of nature-based intervention that offered reciprocal benefits, both for the ecosystem and for the people living in it. So it really takes sort of the traditionally defined nature-based intervention up a notch, in the sense that in addition to, say, encouraging people to have access to green spaces and to expose themselves to take a walk in the forest, for example, and through that alleviate their anxiety or stress level. This intervention has an even more active component to have direct benefits for the environment as well. And this organization published some internal program evaluation to say that these youth came out with improved emotional strength, but we actually don't have more information on this internal evaluation. We don't know how, for example, the organization defined emotional strength, how this was measured, or how many participants they've evaluated. Next slide, please. Now, this is an example of an exosystem intervention called the Sonoma Wildfire Mental Health Collaborative. And this was an intervention that was initiated based on over $1.4 million of funding from different sources after the 2017 wildfires in California. And you can see that we categorize this intervention as an exosystem because it really required concerted efforts across multiple different players in the Sonoma County. So first, as part of this intervention, there was a public awareness campaign. And you can see this image as one example of this public awareness campaign. And the goal of this campaign is to teach people about signs of emotional trauma and to reduce the stigma of seeking mental health supports and to publicize the freely available services. And these free services included trauma-informed yoga, meditation classes, and capacity building programs to train local counselors and paraprofessionals on skills for psychological recovery, or SPR. And then finally, for the youth, they created a mental health application called Sonoma Rises. And there was a scientific publication associated with this mental health app to evaluate how the youth find experience of using it. And unfortunately, they actually cited that there wasn't any clinically significant mental health improvements from using this app, but they said that this could be related to the small sample size and difficulties in conducting a research study in the context of an acute disaster. And I'll talk more about some of these challenges that we identified later as well. I'm conscious so far that the three examples I've shared are all US-based, and this wasn't a coincidence. In fact, if we looked across the board of all these 37 interventions, we identified really most of them were based in high-income countries such as the US and UK and Australia, because in general, there are just more fundings in these countries to run the program, to publicize them so we could identify them from a Google search, for example, or or to have the money to run research studies. But I do want to use this opportunity to highlight one of the interventions that were based in a low and middle income country called Siqi Vibes. And this organization, or this intervention, is part of an NGO based in Nigeria called the Eco Anxiety in Africa Project, or TEAP. So they offer research service that are led by youth, community action events, and the physical and virtual spaces such as Siqi parties that use poetry and open mic settings to have this space to allow youth to share and connect over the climate emotion. And the Siqi Vibes was one of the organizations that played a very instrumental role in the initiative that Emma mentioned about earlier in the connecting climate minds in terms of establishing the youth-led research and action priorities and agenda. And even though we haven't identified any macro system interventions that are specific for youth or for students, I wanted to still share with you what a potential macro system interventions can look like and what are the possibilities that are out there. And so if you look at the panels here, so first of all, if we were to improve the energy efficiency of housing so that homes are more affordable to heat, then there will be a reduction in fuel poverty and then improvements in mental health. As a different example, if urban planning could allow there to be more cycling or walking facilities or make it easier for people to safely participate in these activities, then the physical activity would improve mental well-being and the reduction in road traffic from vehicles and fossil fuels and a reduction in air and noise pollution would improve mental health as well. As a third example, if a city for example, university campus could have more green spaces or more blue spaces, then the trees and water could help to reduce the temperature extremes, and the connection to nature would reduce stress and anxiety as well. And finally, on a more abstract level, if as a society, there could be just more connected communities for people to come together and connect genuinely, these strong relationships would provide the foundation for good mental health, and that are especially needed to withstand the shocks of climate change and this foundation needed for collective climate action. Through this review and scoping exercise, we were identifying several knowledge gaps and opportunities for future action as well. So you can see that many of these examples I shared earlier, they were not formally evaluated, or that they were only internally evaluated. So there definitely are opportunities to potentially collaborate with these organizations to evaluate these on the ground interventions using methodologies and share the results with the public, so stakeholders from everywhere can learn from their experience. Secondly, there are definitely other opportunities to adapt interventions that were initially designed for the general adult population for the youth population or for school context. And thirdly, there are opportunities to adapt interventions from other disciplines that traditionally were not linked to climate change. So for example, in the field of disaster psychiatry, there definitely had been interventions and trials in the past, for example, about psychological first aid that were delivered after, say, Hurricane Katrina or after an earthquake. So there definitely can be lessons learned from there that are transferable to this area of climate change that we're interested in. But adaptation is definitely needed because climate change is not just a singular or standalone disastrous event. It is growing, as we know, it's ongoing, and interventions really need to prepare the participants for not only the current stressor at hand, but also potential future challenges, climate events that could happen, and to really take a more proactive approach in terms of disaster preparedness, and go from there. And this is really related to my fourth point, that in general, we would want to see more interventions that are proactive, adaptive, to support people preemptively rather than waiting for a disaster to hit. And generally, these more proactive interventions are also macro system interventions as well, and that through the macro system means can reach a larger audience. And one of the caveats about, for example, not adapting from disaster psychiatry is that, as I noted, the Sonoma Wildfire Mental Health Collaborative, the study team really had a hard time conducting the evaluative study for the app. So they actually share some insights through a publication. I want to just read a quote from them with you here. So they said, notably, a constellation of challenges and barrier render the conduct of methodologically rigorous disaster mental health research extremely difficult. In the wake of disaster, there are conflicting priorities in terms of providing support to survivors over advancing knowledge by conducting research. Furthermore, disaster response involves multiple stakeholders and agencies, but coordination and collaboration across these groups is challenging. And finally, time needed to plan a study, to secure funding for the study, to obtain ethics approvals, to secure partnership, to recruitment tend to lag well behind the rapid disaster response. So you can see that if we were to only address climate impacts post-event, there could be many challenges we would have to face. And then finally, the fifth point is that there definitely is a need for more sustainable funding and to reduce barriers in accessing services, because we noticed that even while we were doing our study, some of these websites of these interventions are active, but now they're no longer active, and we don't know if these interventions are running or not anymore. And multiple publications also essentially commented that because of the lack of funding, they couldn't do longitudinal assessments or follow people for longer periods of time to see if there were additional benefits, say 1 year or 2 year post a specific climate events. There definitely is a blurred line between the public sector and the private sector, because as you know, many psychological interventions depend on people to pay out of pocket to access them. At least that's the case for where I'm practicing psychiatry in Ontario, in Canada, is that many psychotherapeutic services depend on people having funds to pay for them. Whereas we know in the climate change context, the people who are the most significantly affected actually don't have means to pay for them. So hopefully there could be more public funding to ensure that the people who are the most in need can access the psychosocial interventions as well. Next page. And finally, I would like to conclude my presentation by just sharing with you this really interesting article conducted by a team of Canadian researchers on climate emotion and anxiety among young people in Canada. And this was a national survey that was delivered to 1,000 participants aged, I think, 16 to 24. And there was an open-ended question at the end of their survey to ask them, what are the most important things an education system can do to support mental and emotional health in the context of climate change? And so the respondents say that they want increased climate change content in school. They want to be taught about solutions. They want there to be mental health support and programming embedded in the education system. And to, for example, in one of the quotes, the respondent said, make it feel safe to speak about our feelings and hold safe space within training. And they're wanting to be a balance between receiving positive, hopeful messaging and reassurance, but also really recognizing the realities and to not receive any false hope. So these are not necessarily interventions, but really critical insights if we were to work with young people to co-develop interventions in the future. So with that, I will wrap up the presentation.
Yes, thank you, Siqi, for such a wonderful presentation. Very intriguing indeed. So as we move into our Q&A, I will introduce you to our student discussant, Michelle Buda. Michelle is a registered nurse at the Centre for Mental Health at Toronto General Hospital and has worked with various vulnerable populations throughout her career, noting the complex interplay between mental illness, privilege, and intersectionality. Michelle is currently completing her Masters of Nursing and the student training program in collaboration, training program in the Collaboration Centre for Climate, Health and Sustainable Care at the University of Toronto. She hopes to further her career as an advanced practice nurse to improve quality and accessibility of care for mental health patients and advocate for holistic wellness with particular attention to planetary health. So for the Q&A, I invite the audience members to please submit your questions using the Q&A function, noting that it is different from the chat function, and we look forward to answering those soon. So I can kick off with the first question we have, which is, what is one small step those attending this session could take to address mental health and climate change at their institution? We'll go Siqi.
Sorry, Will, can you repeat the question?
Sure. Yeah, no problem. So the question was, what is one small step those attending this session could take to address mental health and climate change at their institution?
And would this be potentially a university institution?
That would be my understanding, yes.
Yeah, it looks like if university campuses could offer these safe spaces for students to connect, to share their climate emotions, and potentially to work with each other, support each other with institutional support to participate in climate actions, and especially actions that have co-benefits for the climate and for the individual students' well-being. I would say that either virtual or physical space would be particularly helpful.
Sure, fantastic. So, sorry, Emma?
Yeah, I was just going to come in on that as well. Sorry, I had an internet issue for a moment, but I hope you can hear me okay now. Great. So yeah, in terms of one thing, I would want to say several. I guess one thing in terms of an action for the climate that can help mental health through being seen to be actually attacking the root of the problem is divesting. So making sure the university itself is not funded by or putting its pensions or anything into organizations that support extractivist practices or are continuing to fund new oil and gas. So that's one big thing that all universities, educational organizations can do. In terms of student support, to second sort of what Siqi said, that there's spaces around this. We worked with students across the UK and young people to co-design a guided journal intervention, which will be coming out next year, that other universities have been using, including Imperial student studying environment. And also that there's training and support for people who are working in this space or studying in this space, because there's a psychological toll of learning about or working with the facts of the climate crisis. And so we're fundamentally integrating climate and mental health education and giving people the tools as they're learning to tell the truth and to hear the truth and hold the truth, but that there is support around that. And just on the question that came up in the chat around, do our actions really make a difference? So this is, I mean, it's sort of not one or the other, like it, but just to say, I definitely don't want to come across that I'm saying, you know, this just needs to be solved by all of us. And fundamentally, this is on leaders, this is on fossil fuel companies. This is a massive injustice where fossil fuel companies continue to make record profits while people are dying. So, you know, this is fundamentally a question of power. And it's not, the burden shouldn't be held by young people to solve this. At the same time, we do have agency and we have collective agency. So often like businesses, industries, politicians, you know, of course there are power structures, but collectively through the actions of many people, you can have movements, you can have changes in society, and those work in often unclear ways. And what we need is really action everywhere, all at once, everything. So I don't think it's one or the other, and they interact, so that individual actions affect the direction of markets, of politics, and obviously vice versa. You know, we need to hold people to account as well, you know, and talk about, and part of that is just talking about it. So one thing is just to talk about the facts, talk about it with people, but make sure it's also there's room for joy in movement. You know, talk about why it is that you care about it, what you love, what, you know, and how action for climate actually brings all sorts of health benefits. It's where what we're saying is not that we need to sacrifice a lot of things, it's saying that we can have cleaner air, which will make us live longer. Issues, so there's all sorts of things like that. So I guess, to see talking about this and raising awareness as part of that action you can take.
Thank you, Emma, for such a great comprehensive answer to that question. Michelle, do you have any thoughts on the presentation and some of these questions that you've heard today, you know, taking into context your experience?
Yeah, of course. I think in terms of being a student myself, but also working as a healthcare worker, in terms of small actions and not really feeling like, you know, you're making a difference or it might not be worth your time, I think it's really important to note that often individual action influences collective action. So seeing others do something can often inspire other people, even if it might not seem like it, or you might not necessarily see the fruits of your labor, so to speak. You can absolutely make a difference and just inspire others to start engaging in more environmentally conscious or sustainable action as well, which can turn into something much, much bigger. And even if you're doing something little at school, you can try to incorporate that into your studies. Maybe if it doesn't seem like it necessarily relates directly, there definitely could be research out there that is tying environment and climate change into your field. And then once you go on into the workforce, there are certainly avenues that you can explore for sustainable action as well. So for example, in the hospital sector where I work, looking at sustainability teams and how I could be involved there, and joining the green team is definitely something that I found is fulfilling to me, but also inspires my colleagues as well.
Sure, that makes total sense. Thank you so much, everybody. And I will pass you back over to Kirsten. Thank
you to William, Siqi, Michelle, and Emma. That was an excellent presentation and discussion. It will be posted, the recording of the video will be posted and it will be accessible. Just a reminder to complete the evaluation form. We do share it with the speakers after. And just a reminder, this was hosted in partnership with the Collaborative Center for Climate Health and Sustainable Care, and they are having their inaugural symposium on October 22nd, and we're going to link that. And then the next Global Speaker Series will be on November 28th. And it will be on opportunities for social prescribing on post-secondary campuses. And I believe will be another collaboration between U of T and our colleagues in the UK. So please do plan on signing up or attending that. So thank you again, everyone. We've put the link to sign up for the future activities of InLight in the chat box. And we'll end with that.